This is a presentation on a research project titled Radiation Incident Analysis and Communication as part of Incident Learning in Radiation Oncology. This the project is around patient safety, and radiation oncology is no exception um, for areas that are affected by human error and other types of error that can potentially bring harm to patients. It's always been an issue and is an issue in many industries, but back in 2010, for folks that work in radiation oncology, this issue was highlighted in a series of New York Times publications about specific case stories and studies um, that were brought to light and increased the focus and passion and determination within the industry of of how to prevent these issues. And this is one case that I wanted to share in this presentation, just to orient the focus around what we're actually trying to do in improving patient safety. So to read a small clip from this one story, this patient was exposed to radiation, not only to the intended target, but to his brainstem and other healthy organs and tissues that were only supposed to receive a very, very small amount of radiation. And due to a computer error, this patient wound up receiving high doses of radiation to those areas. So this was Scott Jerome Parks, and as he lay dying, he clung to his wish that his fatal radiation overdose, which left him deaf, struggling to see, unable to swallow, burned, with his teeth falling out, with ulcers in his mouth and throat, nauseated and in severe pain, finally unable to breathe. Um, Again, this is just one story, but it's really impacting to the field of radiation oncology, and that's part of what has inspired my personal interest in improving safety. So the focus here is around incident learning. So what is incident learning? Whenever there is any sort of safety event, and not even anything that significant, but sometimes even smaller issues, anytime something goes not according to plan and can degrade what would otherwise be optimal safety, there's an opportunity to learn from that. So instead of sweeping those issues under the rug, bringing them to light and sharing stories and allowing them to be learning opportunities for other people helps to prevent those incidents from happening again in the future. Um, Other industries have benefited from incident learning and have had great success with that, and the airline industry is one example. And a wonderful platform for radiation oncology came out in 2014 with a web based reporting portal and the opportunity for aggregate data analysis. Um, Published literature in radiation oncology incident learning is largely around reporting behaviors and people's comfort level in being able to speak up about radiation incidents and safety events, common error pathways, mitigation strategies, things like that. And there has not been a lot of focus on what I would call the back end of incident learning, which is how to take the information reported into an incident learning environment and analyzing it and communicating it and giving feedback about it, because that's ultimately how change is affected and improvements are made. So my research question is, what is the difference between the volume of incidents reported by radiation oncology staff in community cancer centers that do and do not undergo an analysis and feedback process, specifically with consideration of A, incident severity, B, departmental resources, and C, safety culture? So what I'm trying to do here is gain insight into what is currently in radiation oncology incident learning. What are the barriers and what are the supportive elements to be able to conduct efficient and effective analysis and feedback process? So my research design is to approach medical physicists participating in incident learning. I'm going to approach medical physicists in all sorts of environments. Um, I mentioned a focus on community cancer centers, and that's one demographic that I will be looking into. But information will be analyzed and gathered about all from all medical physicists. They will take this survey questionnaire that will provide some data for analysis, and that will ultimately allow me to make some recommendations for future research and for effective incident learning practices, along with other published literature and that sort of analysis. What is analysis and feedback for incident learning? Analysis can include review, determination of common error pathways, consideration of mitigation strategies, any sort of information that's going to be useful for preventing future incidents. And feedback could be anything from sharing and communicating what has been learned through the system, or involving staff directly with the analysis process. Incident severity, which is one of the potential factors that influence incident reporting and analysis and feedback, is the degree to which an incident brings or could bring harm to at least one radiation oncology patient. And that is the definition that I'm using. It's taken from a general understanding and a lot of different angles that you can come at for this, but it's meant to consider both physical and mental harm that has taken place now or in the future, because there are late effects to radiation damage that are sometimes not apparent early on after an erroneous exposure. And also the risk of physical or mental harm, meaning if an incident did not actually reach a patient or harm a patient, but could have and was prevented, that is being weighted equally in this. So a severe incident that almost happened is just as important to learn from here as one that actually reached a patient. In terms of adequacy of departmental resources, another factor being looked at that weighs on whether incidents may be analyzed or given feedback about, is the capacity that an oncology department has to dedicate resources to incident learning and feedback. That's how it's being considered for this research project. So while patients are routinely coming to the clinic and being seen and treated, all of the work that takes to keep the clinic going is kind of first and foremost, and it's the additional time and resources that are available beyond that for incident learning that are being looked at for adequacy of resources. So how much human resources, software, hardware, what's available for this process specifically if the clinic is humming along with its usual needs being taken care of. And the last factor that I'm looking at is oncology safety culture, and for this project that is being considered as the shared attitudes, beliefs, and priorities that radiation oncology staff members have towards ensuring the safety of their patients. So again, patient safety being minimized mental and physical harm, minimized risk of adverse effects. So safety culture here is being considered kind of a soft definition of those attitudes and beliefs, and what are the priorities to actually keep patients safe. How strong of a priority is that in one particular environment? Convenience sampling is the sampling method that's going to be used here, because these survey questionnaires are going to be sent to fairly large populations of medical physicists, and it will be those who are willing and available to respond that will. This is a layout of the learning process. So you can see that you've got medical physicists here. That is the group that's being approached. Only those that actually participate in incident learning will be feeding data into this project. The drivers being looked at for how they affect incident learning analysis and feedback are severity, resource adequacy, safety culture. And for those that don't use, if those that don't feel that those are the three primary drivers, I'd also like to find what are the other, what else is out there that might be particularly supportive or a particular barrier for incident learning analysis and feedback. Reliance on published recommendations from others might be one possibility. And ultimately, you can see the 4 boxes on the right. I'm looking at, for those incidents that come into an incident system, do no reports undergo analysis and feedback, some, most, or all. So that's the way that I will be quantifying the incident reporting, analysis, and feedback process. Demographic variables I will look at are employment status, gender, the years of experience, and the work environment. Meaning, is the department for radiation oncology in an academic environment, a freestanding center, a government-run facility, that sort of thing. The research instrument that I'll be using is a survey questionnaire that has those demographic variables. It's also going to ask for information about how incident learning is being utilized within the participants' department. And then it will seek to find out some key variables on incident learning analysis and feedback, specifically severity, adequacy of departmental resources, and safety culture. The validity of the questionnaire is very important. I have looked to the literature to see what has been published and what has been done successfully in this area. And I have found that there's a fair amount on incident severity and departmental resources as weighing in on how incident learning is managed within a department. So those factors have come from other literature. Safety culture has a fair amount of publication as well. The Agency for Healthcare Research and Quality Safety for Hospitals has been put out by the Department of Health and Human Services. That has some similar demographic information being pulled and some similar ways that the data is being approached. There is also a safety profile assessment that was published in Practical Radiation Oncology, and that one is specifically relevant for radiation oncology. So that too has been used to support some of the approach and some of the data elements that are being asked in the questionnaire. There are a fair number of limitations to this research. One is the convenience sampling. Whenever there's convenience sampling, there's going to be some bias in the population that is responding, whether it's that they have more time on their hands to respond to a survey, or whether that this is just a more important issue for the respondents. So that can lead to some bias. I mentioned also that in 2014, there was a web portal and incident learning system that was put out by the American Association of Physicists in Medicine and American Society for Radiation Oncology. So those are the main radiation oncology professional organizations. And because that system is fairly new and there's a fairly large number of newly involved departments, there's a dynamic nature to incident learning within radiation oncology, so that may potentially not have completely stabilized yet. Also important to note that medical physicists, although they are largely responsible for radiation safety in oncology clinics, they're not alone as professional groups. There are also physicians, nurses, radiation therapists, and a lot of other professionals and supportive staff that might have different perspectives. And lastly, there is somewhat of a subjective nature to understanding incident severity, resource adequacy, and culture. So in order to address some of these limitations and the validity, the questionnaire will be looked at by a qualified expert, at least one, and somebody that has published in this area and has highlighted specifically that incident learning feedback and analysis are an area that needs some research. So somebody that has some bandwidth and some history of doing work in this area. And I will also have the research tool reviewed by a focus group of medical physicists, so that information coming out of that can be used to improve the tool. Data analysis will be done with a comparison of all of the different data to the different demographic variables. It will seek to understand the impact of incident severity, resource adequacy, safety culture on incident learning analysis and feedback, and any other information that can be pulled out from the survey questionnaire might spark analysis in a different angle. Statistical analysis as well will be done that might shed light on another angle to look at from. There will also be a qualitative component to this research because I'm trying to gain insight into the current environment for incident learning, specifically with regard to analysis and feedback. It's important to understand what is happening now and what are people's experiences with incident learning and report analysis and feedback. And because I am trying to gain insight into people's experiences there, that speaks to a phenomenological approach, um, to getting some qualitative data. So I'm going to do that through an interview process. It will be voluntary, and there will be an ethical component with thorough explanations of the research, the voluntary nature, participation, consent, confidentiality will be addressed, and ultimately interviews will be recorded and transcribed and then analyzed to add some dimension and some additional information to this analysis. And ultimately, a written report will be put together with the information and the insight that was gained. All the findings will be outlined and discussed, as will the limitations and the validity of the research. And ultimately, suggestions will be made, for processes that can effectively and efficiently be used in incident learning, with specific regard to analysis and feedback. And finally, suggestions for future research with a better understanding of the current environment, will be made so that we can continue to expand our knowledge within the field of how to maximize the impact and the potential positive change from incident learning. And that is my intent for this research. It's very exciting, and I'm looking forward to it. And thank you so much for your time and attention.